am Precious Machas, your nurse for today, and today I'm going to perform Nasopharyngeal and Oropharyngeal suctioning. First is identify the patient and assess for signs and symptoms, including the indication of upper airway secretions like gurgling, respirations, and drooling, for you to further assess the client's condition, and then of course confirm the doctor's order before proceeding to suctioning or the procedure. Okay. This is to analyze and execute the suctioning properly, and of course we need to identify the patient for you to check if you are doing or if you are going to suction the right client or patient. Explain to the significant others, family members, or the guardian of the patient that this procedure will help to clear the airway for the patient to breathe clearly or properly and relieve some breathing problems. And of course, you should explain that gurgling or coughing while doing the procedure is normal because we are inserting instruments through her nose or mouth. Next is to enumerate the necessary supplies and equipment before doing the procedure, for you to save time and effort, and of course to do the suctioning properly and efficiently. So these are the materials needed for oro and nasopharyngeal suctioning. First, we need to have face mask and face shield for you to protect yourself from any secretions that the client is voiding while doing the procedure. Next is, imagine that this is the machine for suctioning, and then imagine that this is also a catheter for suctioning, and then this is the lukewarm or clean water, warm water. Then next is the towel for you to put on the client's chin so that any secretions from the client will be catched by this. And next is the sterile and non-sterile gloves. Imagine that I have two gloves. This is the sterile gloves and the other one is the non-sterile. Basin for catching the mucus or for the secretions to be put in here. There you go. Next, for the first step of the suctioning, we should adjust the bassinet into a comfortable working position. If the client is conscious, place the patient into a semi-Fowler's position, allowing for you to perform gag reflex and oral suctioning with the head turned into one side. And of course, the client neck should be hyperextended like so that you can perform the suctioning smoothly and as short time as possible. And if the patient is unconscious, you should position the client into a side-lying position facing the nurse. Imagine that this is my client and I'm going to elevate the bassinet like so, or semi-Fowler's position, for me to be able to suction his or her nasopharyngeal or oropharyngeal. So for the conscious patient, I'm going to perform the oropharyngeal suctioning, and then I'm going to I imagine that I am going to pull the curtains and close the door for us to be able to give client privacy, and of course so that the patient is not scared of the procedure that we're going to do. And then, before starting the actual procedure, we must always make sure that we wash our hands for avoiding or preventing cross-contamination among patients. So, just imagine that I already washed my hands and I'm going to start the procedure. After washing hands, put on the sterile and non-sterile gloves. On my dominant hand, I'm using sterile gloves, and on my non-dominant hand, I'm using non-sterile gloves. We're going to assemble the suction machine right here before, of course, performing the suctioning on our patient. First is to clean or open the catheter suctioning and then rinse it. Imagine that I already rinsed it. I am going to hold the tip of the catheter with my dominant hand, wearing the sterile gloves. And for my non-dominant hand, I'm going to hold the other tip. And insert this part on the catheter machine. For example, I already inserted it like that. Next thing is to turn on the suctioning machine. For example, I already turned it on, and adjust the pressure according to the order of the physician. Adjust from 50 to 95 millimeters of mercury in infants. Okay? And then make sure that the suctioning catheter is sucking or is functioning properly. So if after checking, we should proceed to the procedure. Before doing the procedure includes checking the vital sign of the patient, especially the respiratory. And for the PJ, the normal respiratory cycle is for 18 to 30 cycles per minute. Okay, now we're going to start. Okay. First is to place the towel on the patient's chin, under the patient's chin, so that it will catch the secretions that the patient is going to void. Then next is to measure. We should remove the oxygen mask if there is any. So my patient does not have any oxygen mask. We should always check if the equipment is functioning properly. Then we're going to insert the catheter into mouth along the gum line to pharynx. And then I'm going to move the catheter around like so, like this motion or side motion, until secretions are cleared. So if the client is opening her mouth, we can see if there is any secretions or if there are still secretions being being sucked by the machine. So for example, I'm going to insert the suctioning catheter in the patient's mouth. Okay, ma'am. And then I'm going to move it around. Just imagine that I'm already suctioning the secretions in the patient's mouth. Okay. And then if there are no secretions, we can stop the suctioning. And then after that, we're going to clean the suctioning machine or the catheter while putting it in the basin, and then putting the water or NSS. There you go. And then letting the catheter suck the water until the catheter is cleaned. Okay? When the catheter has no secretions or clean, we should turn off the machine. For example, this is the machine. I'm going to turn it off. Then I'm going to remove the towel of the patient. After removing the towel, I'm going to remove my gloves. And then wash my hands. After washing my hands, I'm going to reposition the client into Sims position. There you go. There. And then the next is I'm going to discard the water or the remaining NSS into the appropriate receptacle. Next is I'm going to rinse the basin in warm and soapy water and then pat it dry with towels. And then I'm going to place the catheter in a clean, dry area. And then I'm going to wash my hands again. For example, I already washed my hands. Next is for the nasopharyngeal suctioning. If indicated, we should increase the supplemental oxygen up to 0 to 100% as ordered by the physician. And of course, when opening the suction catheter, we should wear gloves. And before wearing gloves, we should also wash our hands. When opening a catheter package, we should always remember that do not let the catheter touch any surface except for the packaging itself. Next is I'm going to fill in the basin with sterile water up to 100 ml. Next is to open the lubricant. For example, this is the lubricant, and imagine that the catheter still has a package, and imagine that I'm not holding the actual catheter. And then I'm going to put the lubricant without the package of the lubricant touching the catheter. For example, I already put in the lubricant. Next is to apply sterile and non-sterile gloves on our hands. So I'm wearing sterile gloves on the dominant hand and the non-sterile gloves on my non-dominant hand. Okay, as always, we should always check if the machine is working properly by putting water on the basin for 100 ml. Imagine that the water is already in 100 ml, and then turning on the machine and trying to see if it's sucking properly or sucking well. Remember that we should always hold the tip of the suctioning catheter with our sterile gloves, especially when this is the tip you're going to insert on the client. Coat distal 6 to 8 meters of the catheter with water-soluble lubricant. Okay, we should measure the clients here from the entrance to this part to make sure that we are inserting the catheter tube in proper way, or so that we cannot lagpas to the throat of the patient. So, make sure when he inhales, there you go, and insert it. Nasopharyngeal suctioning must not be more than 3 to 6 seconds. We must make sure on each side. There you go, and after that on the other side. There you go. After that, we should clean the suctioning catheter on the basin and put in the NSS or sterile water, and then make sure that the machine sucks the water, and then turn off the machine if the suctioning catheter is clear of secretions. And after cleaning the catheter, we should place it in a cool, dry place. Then after that, we should remove our gloves, the non-sterile and sterile gloves. Then after that, we should wash our hands. After washing our hands, we should always document for us to determine the progress of the patient, and for the next nurse to know what procedures we've done this patient.